Hello, it is my pleasure to be here with Minister Duclos, Minister Khera, Minister Beech, and for us to have a bit of an update on the rollout of the dental care plan. Minister Beech is going to have information in a couple of moments about the next cohort of Canadians that are going to be eligible for dental care in Canada. I can say that we've now crossed 150,000 seniors in less than a month that received care, which we're exceptionally excited about. We have more than 10,500 providers who have signed up across the country. More than 2 million seniors have applied and have been deemed eligible for the program. And to put that in very real terms, I had an opportunity on Friday to be all over the GTA, talking to seniors about what it meant for them, the dignity of being able to get dental care, many of whom have not had care in a very, very long period of time, and talking to dentists who would be forced to deal with emergency situations, have patients that couldn't afford to come in. Now they're being able to do that preventative work, and how extraordinary that is for their health. So great news, the program continues to roll out well. July 8th will be the day the new portal will be active. That portal will allow a claim-by-claim processing, which means that there will not be a requirement to participate in the plan officially. You can just deal with that on a claim-by-claim basis. But at this point, it's my privilege to turn it over to Minister Beech, who has some good news about the upcoming cohort.
Thank you very much, Mark. Hello, everyone. Well, I was in my community over the weekend, hats off day, 50,000 people walking down the street, and I met some of the people out of those 150,000 individuals who have actually been able to see a dentist, which has been absolutely life-changing for some of those individuals. We currently have over 2 million individuals enrolled, including individuals over 65, which was the most recent phase. I'm happy to announce today that we now have a clear date for the next phase of the dental rollout, starting on June 27th of this year. Children under the age of 18, as well as individuals with disabilities, will now be able to access the Canadian Dental Care Plan. That is 1.2 million additional Canadians that will qualify. They will be able to apply directly online at canada.ca/dental. And then the remaining Canadians, namely those between the ages of 18 to 64, just over 4 million people, will be able to apply as of January 2025. So this is great news. It's only a matter of weeks away. People can start getting ready for those applications. And with a little bit more detail, I'm happy to pass the mic over to our other colleague, Minister Khera.
Thank you, Minister Beech. Good afternoon, everyone. And allow me to just take a moment just to recognize the leadership and dedication of my colleagues, particularly Minister Holland, Minister Duclos, and Beech, for delivering Canada dental care plans. You know, the fact that Minister Holland talked about over 150,000 seniors have already received the dental care through our plan, it's changing lives. It's changing lives in our communities from coast to coast to coast. And, you know, I just also want to recognize the fact that just last week we celebrated the National Accessibility Week, and it's a chance for us to first and foremost recognize a tremendous tremendous leadership of the disability community in moving the dial forward on the work that we've been able to do in creating a barrier-free Canada, but also talk about some of the challenges that lie ahead. And, you know, I'm so grateful that the next cohort are persons with disabilities. We know affordability is a major issue when it comes to persons with disabilities. They're more likely to live in poverty than compared to Canadians without disabilities. So the fact that the portal for June 27th is going to ensure that persons with disabilities will be able to apply for the dental care that they need. We know this is a game changer for so many in our communities. We're very excited to ensure that, you know, more Canadians will be able to get the dental care that they need. It's not just, you know, oral care isn't just about, you know, getting your teeth cleaned. It's about dignity and respect. And I'm so happy that we're going to be move forward and support some of the most vulnerable in our community. And to talk more about this, I'm happy to turn it over to my colleague, Minister Duclos.
Bonjour tout le monde. Comme vous l'avez entendu en anglais, une très bonne nouvelle aujourd'hui pour les Canadiens et en particulier pour les Québécois. Une moins bonne nouvelle, je dirais, pour M. Poilievre, Pierre Poilievre, qui disait il y a quelques jours à peine que le régime canadien de soins dentaires n'existe pas. Alors, mauvaise nouvelle pour lui, il y a 2 millions de Canadiens qui se sont inscrits jusqu'à maintenant. Plus du tiers de ces 2 millions sont des gens qui habitent au Québec. Au Québec, on a aussi le taux de participation le plus élevé de tous les fournisseurs dentaires de tout le pays, 60% des fournisseurs de soins dentaires, c'est-à-dire les hygiénistes, les dentistes et les denturologues sont déjà inscrits après à peine un mois au régime canadien de soins dentaires. Et comme vous l'avez entendu, ce sont 150 000 aînés, dont plusieurs dizaines de milliers, évidemment, au Québec, qui ont pu, pour la première fois, parfois depuis plusieurs années, aller voir un dentiste, recevoir les soins dont ils ont absolument besoin pour maintenir une bonne santé bucco-dentaire, sachant que la santé bucco-dentaire, c'est essentiel pour la santé générale du corps, la dignité, la capacité de vivre aussi dans la sécurité physique et mentale. Et je dirais que l'annonce aujourd'hui, donc du 27 juin, est particulièrement importante pour les familles du Québec. Ce sont à peu près 300 000 enfants et 300 000 personnes qui ont un certificat pour personnes avec handicap qui vont, à partir du 27 juin, être capables au Québec de s'inscrire à ce nouveau régime canadien de soins dentaires. Donc, de très, très bonnes nouvelles. Il y a encore beaucoup de travail à faire, mais je vous dirais qu'au Québec, encore plus qu'ailleurs au pays, le régime canadien de soins dentaires va très bien.
Ready for your questions.
Sir, I have a question about pharmacare. Specifically, why call it a single-payer program if you're being very blunt about the fact that people can stay on their private plans?
Well, it's important that folks have choice. We want to make sure that if people are happy with their private plan, that they can continue to use it. Obviously, this plan that we're embarking on as a first step for pharmacare only covers diabetes medications and related devices and contraceptives. So most plans are going to be covering something more comprehensive than that. And we want to make sure that everybody has choice. But one of the things that is a big problem is, and you could take diabetes medication. For somebody who's in a vulnerable position, even with insurance, they may have a very large copay, where that copay is prohibitive for them to be able to stay on their regime of medication. And I talked just a week ago with Dr. Mehta, just as one example, where he has patients in front of him. He says, look, here's what you got to do to manage your condition. And those patients are not able to afford the medicines that he's saying they need to take for their health. And what Dr. Mehta and others tell me is that person ends up with very serious conditions. It's certainly what I saw when I was heading Heart and Stroke in Ontario. Heart disease, stroke, you can talk about amputation, you talk about kidney failure. Not managing diabetes has a terrible cost. So making sure that everybody can afford that medication is absolutely essential.
Why not just call it mixed payer? And that would be clear to the insurance industry as well, because I think they're pretty confused.
Well, I think it's not confusing. I think that the reality is there's more choice, and that's a good thing for Canadians. And what we wanted to be able to do is make sure that there was a single-payer universal system so that we can test that, we can see that. Remember, in Prince Edward Island, we have a mixed payer system, which is a fill-in-the-gaps model, that's been very successful, reducing co-pays for islanders down to $5, saving them huge money. I've talked to a couple in PEI saving hundreds and hundreds of dollars a year in their drugs as a result of the action taken there. So being able to have two real-world models that we can evaluate is extremely important, and so too is it important to make sure that people don't lose choice in this process.
En tant que ministre de la Santé, comment vous avez réagi en entendant les propos anti-avortement du député conservateur Arnold Viersen en fin de semaine?
C'est absolument inacceptable. Pour moi, c'est un enjeu fondamental pour notre pays. Les libertés pour une femme de faire un choix individuellement, sans aucune influence d'un politicien, est absolument essentiel. Et pour moi, ce n'est pas juste une question d'avortement. C'est aussi une question de contraception. OK, d'accord, si quelqu'un oppose l'avortement, OK, c'est pas mon position, mais il y a beaucoup de députés avec cette position, avec le Parti conservateur. Mais pourquoi la personne-là est aussi contre la contraception gratuite? Parce que ça, c'est un problème majeur pour les femmes partout au pays d'avoir accès à la contraception. Et aussi, le même député a dit qu'il est contre le mariage gay. Et pour moi, les issues comme ça sont fondamentales pour notre pays.
En même temps, Viersen a été rappelé à l'ordre, il a remis les pendules à l'heure, si on veut, qu'une déclaration. Puis le chef, Pierre Poilievre, est assez clair, lui, qu'il est pro-choix. Donc, est-ce que ça vous rassure pas? C'est pas assez...
Oui, pour moi, il y a plus de 50% de députés dans le Parti conservateur qui sont contre l'accès d'avortement pour les femmes. et tout le caucus conservateur sont contre le contraceptif gratuit pour les femmes. Et il y a beaucoup de personnes, les députés dans le Parti conservateur, qui aussi comptent l'information sur les santé sexuelle. Et les trois choses en même temps, ça indique pour moi une opposition de la liberté de femmes généralement.
Vous croyez, M. Poilievre, quand il dit qu'il est pro-choix? Est-ce que vous croyez que c'est sa vraie position?
Pour moi, si M. Poilievre ne changeait pas les lois ici pour le votement, pourquoi il y a une position avec son député de dire, particulièrement quand la majorité des députés conservateurs sont opposés de votement, s'il n'y a pas une politique pour le parti, de dire clairement que s'il va y avoir, par exemple, un projet de loi et il y a un gouvernement majoritaire pour le Parti conservateur et la majorité des députés aux chambres de communes sont contre le votement, qu'est-ce que M. Poilievre va faire? Et deuxièmement, d'accord, OK, si la majorité des députés sont contre le votement, pourquoi le Parti conservateur n'appuie pas le contraceptif gratuit? Si la personne est contre le votement, c'est logique pour moi que la personne appuie l'idée que toutes les femmes partout au pays peuvent obtenir le contraceptif qu'ils ont besoin. Ça, c'est logique pour moi.
M. Duclos, sur l'assurance médicaments, compte tenu de l'avancement du projet de loi, doit-on comprendre que votre gouvernement a fait une croix sur le respect des champs de compétences?
Non, ce n'est pas une question de ne pas respecter les champs de compétences. Au contraire, il faut respecter les champs de compétences. Un exemple évident de l'annonce d'aujourd'hui, ce sont les soins dentaires. Les compétences du gouvernement du Québec sont totalement respectées. En plus de ça, le gouvernement du Québec peut en faire davantage s'il le souhaite. Il peut augmenter la couverture des services couverts, la couverture des gens couverts par le régime québécois de soins dentaires. C'est la même chose pour l'assurance médicaments. On sait qu'il y a des lacunes, y compris au Québec, en matière de coûts et d'accès aux contraceptifs, aux médicaments pour se protéger contre les effets du diabète. On rencontre des gens partout au Québec qui disent qu'ils ont parfois, les femmes en particulier, qu'ils ont parfois de la difficulté à choisir entre ce que je paye pour le loyer à la fin du mois ou si je me garde un peu d'argent pour avoir mes contraceptifs, ma pilule durant tout le mois. Et en terminant, j'en rencontrais avec la députée Soraya Martinez il y a quelques semaines à peine à Montréal. C'est surtout des femmes vulnérables qui n'ont pas beaucoup de moyens et qui doivent choisir à nouveau s'ils ont les capacités de s'acheter la pilule contraceptive qui vient avec un paiement, là, tout n'est pas gratuit, ou s'ils vont au contraire sauter un mois parce qu'ils ont des enjeux de budget plus importants.
Mais alors pourquoi ne pas donner un droit de retrait avec compensation au Québec? Le Bloc a proposé un amendement.
Et il y aura probablement, effectivement, ce genre de discussion. Comment est-ce qu'on travaille efficacement avec le gouvernement du Québec pour atteindre les objectifs que non seulement le gouvernement canadien s'est donné, mais que beaucoup d'acteurs sociaux et en matière de santé publique au Québec se sont donnés aussi, c'est-à-dire d'assurer l'accessibilité et l'abordabilité à des médicaments essentiels.
Avez-vous des discussions avec le Québec?
Moi, personnellement, non, parce que je ne suis pas ministre de la Santé, mais mon collègue, certainement, dans mon ancien rôle, je le faisais. Oui, c'est une conversation parallèle à celle qu'on a ici à la Chambre des communes, parce qu'il faut d'abord passer le projet de loi, et ensuite travailler respectueusement, mais aussi efficacement avec les provinces.
Apologies if this has been asked already, but a lot of hay has been made over the weekend about comments you made in question period last week around road trips. Can you just tell us about what you were getting at there with, being stuck in a car for 10 hours and just having kids just being able to watch the planet burn when it's a pretty time-honored summer tradition? Like, are you kind of insinuating people shouldn't travel in the summer? What's going on there?
No, of course not. And I think it's just dishonest, and it's emblematic of an approach that I think Canadians have to sit back and look at. Of course, all of us support the idea of going on road trips. I just don't support them when they're 44,000 kilometers long. You would have to go across the entire globe, and you'd still have another 4,000 kilometers to go in order to get what the Conservatives are promising is a rebate. So what I was saying in the House was, if you're promising Canadians, if you're stepping out at a moment where they're talking about ending climate action, they're talking about ending a price on pollution where people get more money back than they pay, and you're talking about returning to the days when Canada was going into international climate conferences and being a force to ruin them and to be against climate action, that the recompense for that is that you'd have to drive 44,000 kilometers to get their benefit. I think that's disingenuous. And I think selectively quoting me, when they could see the context of question period and what we were talking about, shows, frankly, a desperation in their message and a willingness to be in social media spaces to contort messages that are just untrue.
Does it change the strategy in question period at all, though, how you may approach some of these matters, just given we know politicians of all stripes do selectively clip things out of question period and post just one side of a debate all the time? Is there some danger in bringing forward like hyperbole like that?
No, I'm not against it. I had a great conversation with all kinds of people all across the GTA and in my riding, and lots of people came up to me and were talking about it, and it creates a good conversation. And here's the thing with truth, it's true. So if you want to go out and be dishonest, if you want to misquote me, if you want to use things out of context, there's a problem in life. You only have to be caught lying once for people to know that you engage in that behavior. For me, I think a conversation around our climate and what we're going to do of our climate and the kind of policies that we're going to take on our climate are extremely important. And if you're going to reduce a discussion on the existential crisis of climate change down to a slogan around a ridiculous policy that you'd have to drive 44,000 kilometers in order to realize the benefit of, and try to reduce it to a 30-second clip on Instagram, and that shows you the level of seriousness with which they're taking the issue, and I think that's more reflective of them than it is of me.
Thanks, Minister.